So my name is Dr. Aamer. I'm the co-founder and senior clinical officer of the Harley Street Skin Clinic, and we've seen a great increase in the requests for non-surgical body sculpting over the past few years. So the Harley Street Skin Clinic has been around since 2006 when we first inaugurated. However, my history and Leslie's history in the aesthetic business goes way beyond that. Leslie's been around over 20 years when we met, and I qualified in 2006, and I've been dealing with skin conditions and cosmetic and aesthetic treatments ever since then. So we have had an interest in this sort of industry for a long time. And when we got together, we decided to start a clinic in Harley Street. And initially we were doing 1 day a week, which very quickly went to a full-time clinic in 1, 2 and 3 rooms. And by 2010, we had a full building in Harley Street with a full-time clinic with over 11 doctors. We've got therapists, and we've got a whole team to support that. So we've had quite a lot of experience. On average, I will see about 4,000 patients, between 3,000 and 4,000 patients in a year. So we have a good experience with what the industry demands are, what the patient demands are, and what the technology is that's available to help us to achieve those results that they're looking for. We first heard about the ONDA at one of the medical events, one of the conferences. It's something we saw. I came back and talked to Leslie about, and then through Paula we started to look at it further. Since starting to use the ONDA, we've treated about 200 patients, each patient requiring about 5 treatments on average, and that means that we've carried out about 1,000 treatments. And that has given us a lot of data to look at and to see the results from, and we're very happy with where this is going. The patients are happy with the outcomes. It's really important to select your patients properly and to explain to them what can be achieved and what can't. And we've found that our patient selection has been good. We have a lot of celebrity patients as well, and a lot of them don't want the downtime because they're on screen a lot of the time. They get very little time off, and they want something that gives them the results without being too obvious that they've had something done, and they're really happy with this treatment as well. I like all 3 of the functions that the ONDA tends to offer. I like the fact that it is an effective cellulite reduction technology, and there is no other technology that does the same, non-surgically. I love the fact that it reduces fat very effectively, and that is its big advantage. However, you're also getting that bonus of skin tightening as well without using other technologies, though where we find lots of skin laxity, we can always augment it with some radiofrequency as well. We've seen an increase in the number of men who are coming through now. About 15% of our clients are men, and we're offering the ONDA to all of them as a non-surgical option, and we're seeing good results with men and women. Now clearly women have cellulite more prevalently than men. However, with the aging process of men, there is estrogenization, and we are seeing bobbly skin, which isn't technically cellulite, but it looks a little bit like that. Men are benefiting from that as well. One of our priorities whenever we see patients and advise a treatment is patient safety, and that should be the priority for every practitioner out there. And what we find with the ONDA is that we can be rest assured that it is one of the safest treatments that we can offer our patients, with the least number of side effects, especially when it's related to tissue damage, to burns, and to adverse outcomes.